Welcome everybody. Very excited to welcome our special guest tonight, Dr. Shauna Dingman. She is a chiropractor and owner of Elevate Women's Health Center in Port Perry. Her focus is on the health of women and children through low force chiropractic care, advanced genetic testing, and hormone testing. She is not just an amazing practitioner and health educator, she is also a mom of three amazing kids. She is an active fitness enthusiast and she shares her practice with her husband, Craig. So I am going to pass this on to Dr. Shauna and I hope you enjoy, everybody.
Great. Thanks so much, Cindy. And I just feel so privileged to be here. I love being able to speak, especially to women. And Cindy, I really appreciate you inviting me to speak about this topic. Arthritis is something that, when you asked before who has arthritis and I raised my hand, it's because I know that I have the beginnings of it. I've seen it in my own spine. And so this is now a topic that is becoming very near and dear to my heart. I'm turning 50 this year, so I feel like I'm kind of excited. I'm just about in the sisterhood of women who are over 50, and I don't know whether this is too much information, but like many of you, I'm heading into menopause as well. So I have seen really big changes in my body over the last couple of years, and I know that this is a topic that comes up all the time in practice. My practice is called Elevate Women's Health Center. So as Cindy mentioned, I am a mom of three. I got interested in the care of women right off the bat when I was in chiropractic college. I was pregnant when I was just graduating. And so my husband, Craig, who's also a chiropractor, we sort of started practices with a newborn baby, and that just kind of blossomed into pediatric care. I have a postdoctorate certification in pediatric and pregnancy care. And in caring for all the moms, and now being 20 years in practice, I've sort of seen those moms, age with me. So I feel like we're kind of all going through some of these things together. And women's health, as you probably have realized, it's a real challenge. So being able to address some of those challenges, I feel like women often tell me they don't really feel heard by their traditional practitioners. The complexity of the things that we deal with can really just be an enigma for a lot of practitioners. So that's why I got interested in really specializing in the care of women, and I just love it. So I'm really happy to share this information with you tonight. You probably know that in all things to do with healthcare, the information is always evolving. So the things that I might share with you tonight, some of them may be new and different, things that you haven't heard. Some of them might challenge things that you've already heard, and some of them we may find out 6 months from now it's outdated and there's a new thing going on. And that is the nature of healthcare. So I am going to share my screen, and I've got this presentation for you to watch. There we go. Okay. So if you're wondering what the rest of my family looks like, this is them. These guys are my absolute pride and joy. My husband is over there on the left. That's Craig. And I love the fact that I get to practice with my husband and I get to bounce things off him all the time. We talk shop all the time and I love it. I think it's great. If we're not talking about chiropractic, we're talking about the kids. So the topics of conversation in our house are quite limited these days. We'll throw COVID in there right now too. Jenna is the beautiful one with the flower in her hair. She's 16. My son Jackson is the tall one in the back. He's 21. He's finishing up his 4th year at Laurier right now and cramming for exams. And then my little guy there, Cole, I shouldn't say that. He's 13. He's not a little guy anymore. But that's my family. We also have 2 cats who are crazy. And we just got a dog last year, like I think half the rest of the world's population. And we're adapting to having a dog and 2 cats in the house. It's nutty half the time. So this is what we're going to talk about tonight. What is arthritis? I always think it's really good for you guys to know what you are actually dealing with and make sure that we're clarifying just the information around this particular health challenge. There are lots of different types of arthritis, as you guys probably know. So we're going to talk about what the different types of arthritis are. We're really only going to talk about one main type as we go along, but I'm going to tell you about three of them and then just know there are a whole bunch of other ones. Why are women more prone? Did you know that women are actually more prone to most kinds of arthritis? We're going to talk about why that is. What does arthritis look like? I'm going to show you what it actually looks like on X-ray, because again, I think if you can visualize what's happening in your own body, it just helps you know how to deal with it better. What can you do to feel, well, that's supposed to say to feel, to prevent it and or feel better? That's really the goal, right? Is to make sure that you guys have some tools that can help you move forward with this and possibly decrease some of the pain if you're having it. If you don't have pain, to make sure that you never get it, ideally. And then finally, I want to share just a story of encouragement with you. It's Betty's story. And when we get there, two of you anyways, on this call, you'll know who I'm talking about, and you may even know the story. I've told the story a million times in clinic, but it's such a story of hope, and I just want to leave you guys with that. So what is arthritis? This is a foot that you're looking at, and the feet are one of the most common places that people experience arthritis. So you can see that in the middle of those toes there where the arrows are. This is really what we're going to look at. This arthritis, the word arthritis means inflammation of the joints. Anytime you see the suffix itis, it always means inflammation, and then it's whatever comes before it. Arthros means joints. 25% of people, 25% of all people have arthritis. And obviously, if you're older, that number goes way up. So they say that it affects 60% of all women over the age of 65. But because the most common place that we talk about arthritis in is hands, knees, feet, and hips, they don't tend to talk about it so much in the spine. And I think that number, 60%, it's way under what it is. I think that it's actually way more than that. I X-ray the vast majority of my adult patients. I would say probably 95% of the adult women that I see in the office. So I get to look at spines on X-ray all the time. And it would be a really rare thing for a woman over 65 to not have arthritis in the spine. But when we talk about that, women will say, well, I have chronic back pain or I have chronic neck pain. And when we look at their X-ray, what they actually have is arthritis. But when we use the term arthritis, we're typically talking about hands and knees and feet. So I actually think that the incidence number is way higher than 60%, but that's why it's so important to have these discussions and understand what can we do about it, because the vast majority of us are going to be dealing with it if we're not dealing with it already. So I hear people ask me all the time, what's the difference between osteoarthritis and normal arthritis? Or if they tell me that they have arthritis, I'll say to them, do you have osteoarthritis? And they'll say, I don't know, do I have rheumatoid arthritis? How would I know the difference? So let's just talk about each of the different kinds so that you know what it is that you have. And sometimes the type of arthritis that you have, you'll have very different treatment depending on what that is. So when you hear the word osteoarthritis, if I was going to say there's like a normal arthritis or the regular kind of arthritis, this would be it. This is the wear and tear, old age kind of arthritis. My family all came from farms down in farm area of Ontario. So I feel like all of my great aunts and uncles, my grandparents, they all had osteoarthritis from jumping on and off tractors and jumping out of haylofts and all those kinds of things. So they had really bad knees and hips and lots of achy joints. That's the kind of thing that we're talking about. And I will show you what that actually looks like. Osteoarthritis, it originally, like in a younger population, it affects men more than it affects women. But as we age, it affects women much more. And we tend to feel more pain than men do. I'm not sure why that is. I have a feeling it's because of our hormones, but we can talk about that a little bit later. Oh, hormones. Rheumatoid arthritis. So again, any kind of arthritis is an inflammation of the joints. This one has a very different cause though, rheumatoid arthritis, which is much more prevalent in women than it is in men, and it hits women at a much younger age. So the typical incidence for rheumatoid arthritis is between the ages of 30 and 50 when it's diagnosed. It is an autoimmune disorder. So what I mean by that is it is the body mounting an immune reaction against its own tissues. And in particular, it's attacking the synovium of the joint. So around every joint, there's like this little bubble. And within that bubble, there's connective tissue, and there's actually liquid lubricating fluid. And so our immune system, if you have rheumatoid arthritis, it actually creates an immune response against those tissues and tries to eat it away. It's very painful. The difference between rheumatoid arthritis and osteoarthritis as well is that osteoarthritis, you can get osteoarthritis in your right hand, for example, but not your left hand. It doesn't necessarily have to affect similar areas in the body. Whereas rheumatoid arthritis tends to be much more symmetrical, whereas somebody is not as likely to have it only in one hand or one foot. They're probably going to have it in both because it's more of a I don't want to say it's a more of a metabolic disorder, but because the body is mounting an immune response, it's going to attack all tissue of that type in an area. Gout. So you guys, maybe none of you have gout. I bring it up because it does actually come up more often than I would have realized in clinic. It typically will affect men more than women, but I have had women who have it. And honestly, everybody seems to know someone who has gout. So I thought I would just tell you that gout is that if you picture a picture of an old man with his foot up on the table and a great big bandage around his big toe, that's gout. And it does actually tend to affect the big toe more than anything else, although it can affect some of the smaller joints of the foot and into the hands. Gout is actually a buildup of uric acid in the body, which you sort of get that from the body not being able to process proteins as well as it should. And it can come and go. You can have long periods where you don't have any pain from gout, but boy, when people get pain from gout, it is ridiculously painful. I mean, they really almost have trouble functioning. And there are many more kinds of arthritis, but I think, those are sort of the three big ones that I thought I would put out there. We're really going to focus tonight on osteoarthritis because, like I said, it's the much more common one. It's the most common one that I see. Rheumatoid arthritis has to be managed very carefully by usually a rheumatologist. That's way out of my wheelhouse, but I see osteo all the time. And I think that as a natural healthcare practitioner, there are so many things that I can help you with in that realm. So what does it look like? These are X-rays, obviously. I love looking at X-rays. I love being able to see inside the body. So if you want to know what should a normal joint look like and what does an arthritic joint look like, this is the knee. And this one here is a normal knee. So what you see here, there's the tibia. This over here, that's the fibula. Up here, that's your femur. And then this shady kind of circular space, that's the kneecap. And what I want you to notice here is this black space in between. That's the joint space. So within that space, remember how I said there's a capsule, there's this synovium that goes around any kind of a joint and inside it. So in this area here, if you've heard of people who have torn their meniscus or people who have torn their ACL or their PCL, that's where you would find these. Soft tissues don't show up on X-ray, so you just see it as this beautiful black space. And one of the other things that we like to see in normal joints is clear margins around the bone. So see how all of these are very clear. This is what normal should look. That's what a normal knee joint should look like. If you contrast that with this one, it's a very different picture. So the joint space has been worn away. You don't see those clear margins. See how the bone tends to look very fuzzy? Again, that's what inflammation looks like. If you picture if somebody burnt themselves really badly and they had that red kind of swollen looking, really painful looking skin, that's kind of what's happening in the joint. It's swollen, it's got lots of fluid there, it's very painful. Joints have tons of pain receptors. You've probably figured that out if you have arthritis. And so when you have inflammation in and around any joint, it's going to hurt and it's going to limit motion. And when you look at this knee, you can really see that idea of worn down. It's just worn down and worn away. These are hands. Both of these hands are arthritic. So these bones all in here, that's the wrist. The wrist is actually comprised of 8 different bones. I don't know if you know that. Fun fact. But if you look up here, so this would be this joint that I'm showing you right here. That would be this one right here, the bottom on the thumb, the distal, the bottom joint. And then this one up here is called the distal joint. That's this one here. And you can see they're just, the joint space is all worn away. They're actually misshapen. If you ever see a picture of rheumatoid arthritis, right in here, you would see these bones coming up like this. And then these bones here would take a wild angle off like that. You will often see people with very misshapen hands when they have it in their hands. Okay, so that's an idea of what arthritis looks like in the knees and in the hips. Oops, hang on. Okay, there we go. I want to show you what arthritis looks like in the spine. This is something that I see every day. And the reason that I think it's a good idea to see what it looks like in the spine is because I think that we tend to see arthritis in the spine long before you see it anywhere else. And so I'm going to sort of walk you through Radiology 101. This is a normal view of somebody's neck. Let me get my cursor going here. Oops. Hang on. There we go. Okay. I don't know why I don't have a mouse anymore, but oh well. So this is a normal view of somebody's neck looking at it from the side. So it's as if I was standing like this and they took the X-ray this way. Those white block shaped things, those are the bones. So there are 3 things that I want you to notice. I have to look at all sorts of different things on an X-ray. I only want you to notice 3 things in a normal X-ray. The first is, what does the bone look like? What is the quality of the bone? That bone that you see there, it's not really square, but it's kind of square. That's what normal spinal bones should look like. What you don't see is jagged things, spurs coming off the front of it. And I'll show you what that looks like in the next picture. The next thing I want you to notice is whenever you look at the spine from the side, no matter where you're looking in the spine, whether it's low, middle, or high, when you look from the side, you always want to see a C-shaped curve. When you look from the front, it should be straight like my finger, but from the side, it should always have a C-shaped curve. So this spine has a nice C-shaped curve. And then the last thing I want you to notice is in between the blocks of bone, there's a black space. That's the discs. So I want you to notice that all of those black spaces are consistent. They're nice and plump and they're the same as you go up the spine, okay? So that's normal. Contrast that with, if we're looking at the X-ray on your left there, that is a picture of osteoarthritis. This is what osteoarthritis looks like in the spine. So first thing we look at is, okay, let's look at the quality of the bone. Those bottom 3 where it actually says spur of bone, narrowing of disc. So that's where the arthritis is really focused in the neck. And to be honest, that's probably the most common place that I see it. The bottom of the neck seems to take the brunt of all the wear and tear of our lives. And when I put my hand up and said that I have arthritis, so I had a set of X-rays, a set of spinal X-rays done really recently, just about a month ago. And for the first time, my cervical spine X-ray or my neck X-ray is showing just a little bit of degeneration right at that same point as this one. Okay, so what does the bone look like? You see that spurring there? That's from wear and tear and friction. That's how the body reacts to it. And you see that narrowing of the disc space. So that is another part. And this spine, if you look sort of at it on the whole, it's lost almost all of its curve. And that's really how it starts. So the way I see it in younger people is, first thing that happens is they start to lose the curve. When you lose the curve, the normal structure of your spine, it sets you up for wear and tear. And so as a chiropractor, my goal is to catch it before the loss of the curve becomes wear and tear with spurring and disc space. Can we get some of that curve back? Can we make the spine function as if it has the curve? Why does it matter? It's not just about pain. If you look at the picture on the right-hand side, we're looking at an MRI. So MRIs show soft tissue. And what you see, that sort of white blob at the top, that's the brain. So don't forget that the reason as a chiropractor that I'm looking at the spine is because inside your spine is your whole nerve system. Houston Central for everything you think and do and move, every part of you is held inside your spine. And so the healthier your spine is, the healthier your nerve system is going to be. That's why this matters. So on that MRI, you've got the brain, and then from that, you've got the brain stem. But see where it narrows, where that blue line is? If you have degeneration, like what you're seeing on the left-hand side in the X-ray, this is typically what you're going to be seeing in the spinal cord. You see that pinching. And again, why does that matter? Well, it matters because those nerves are all going somewhere. So those nerves, they do go to your fingers and your hands. If those nerves are trying to send messages to your hands about movement and function and they can't get the message out, can you imagine that over time you might start to lose function in your hands? Lack of function can create wear and tear. What if those nerves are going to the heart? Can you imagine that somebody who has that over a long period of time, maybe they're going to have high blood pressure or high cholesterol because the cardiovascular system isn't getting the right messaging from the brain. So that's like from a bigger picture standpoint, from a more than pain standpoint, that's why being able to catch this stuff early is so important, because not only do you take will you be able to help prevent pain, but you will also be able to create just more overall health because the nerve system is going to function at a way higher level. Something to ponder. So here's something that I have been thinking a lot about, especially as I was preparing this, is I'm showing you two X-rays here of two different women. These are both patients of mine, people I've seen recently in clinic. And by the way, nobody on this call, so don't worry. The left side, what you're seeing is the side view of somebody's lumbar spine or their low back. So you probably have heard of people say, I've got chronic degeneration, or I've got a slipped disc, or I've got degenerative joint disease. That's arthritis. When people say those terms, that's what arthritis is. And so that picture on the left where I've circled red, that's what it looks like. So if you think about those three things, how's the curve? The curve is pretty good. In this case, how's the bone? Well, you can see lots of spurring in that area. And how's the disc space? It's almost entirely gone. This woman is 51 years old. So she doesn't have arthritis in her knees or hips or hands, but she has arthritis and it's been there a long time. The woman on the right, it's much more subtle. So again, if we look at our three things, how's the curve? Not so good. What are the bones looking like? Well, you can see where I've put that arrow. It's starting to spur and she's starting to lose her disc space. This woman is only 41 years old. So she's almost 10 years younger than I am. She had no idea that she had this, but again, it's there. It's a degenerative process that's starting to happen. And if it's happening in her spine, I wonder, will she be that woman that 10 years from now or 20 years from now has it in her hips, knees, and ankles? If we even back it up more, here's an X-ray of a young woman. And this is a side view of her neck. So if you look at this first question, how's the curve? Not only is the curve not there, it's actually started to grow the opposite way. So if it started out like this, it straightened, and then eventually now it's starting to go like this. So she doesn't have any spurring or loss of disc space yet, but it always starts with this. So I want you to just type in the chat, how old do you think this person is for this X-ray? And Cindy, I can't see the chat because I've got my full screen going with the presentation. So I'm going to let you sort of let me know who's saying what in the chat, because I'm interested to see if anybody can hit the nail on the head here.
Okay, I've got 55, 30, 40, 30. Yeah.
Those are great guesses. This is a 14-year-old girl. And I see this all the time now. And I'm sure you can probably guess why. I mean, we don't know why this is happening per se, but I never saw this 20 years ago when I first started in practice. And I think that we are dealing with a generation of teenagers who have the spines of people that 20 years ago I would have only seen in 40, 50, 60 year olds. This is going to be a huge, huge problem for their health if they are already starting the degenerative process that creates arthritis. And she's 14 and she's not a one off, she's not an anomaly. What is that going to look like when she's 34, 54, 74? So if you have grandkids, I cannot stress enough how important they're taking care of their body, moving lots. Like, you guys know these kids, they're on their devices all the time and it's at the expense of normal play. So they're not getting out and moving anymore. And they're sitting all the time in this kind of a position, and it truly is affecting their structure. And like I said, don't forget, her spinal cord is sitting in there. It is not possible for her spinal cord to function at 100% when her spine looks like that. So this is a big, big deal. It's a big deal for you guys. It's an even bigger deal for the younger generation coming up, because the question I ask is, if it starts like this, but it takes 30, 40 years before you start to get it in your hips, knees, ankles, all that, can we stop it if we know that it's there now? Just food for thought. Okay, why are women more prone? Well, there are a number of reasons, number of things that we postulate. First thing is weight. And I will tell you this, that boy, in the last 3 years, I have found that maintaining a healthy body weight has never been more challenging. For those of you who you're on the other side of menopause, I mean, you women tell me all the time that every calorie seems to count twice when you're in your late 40s, and then it counts about 8 times once you hit 50 and over. So weight gain, so as we lose estrogen, weight gain is actually a protective mechanism. I know we don't talk about that enough in healthcare, but as you lose estrogen, you put on fat, because estrogen is actually stored in fat too. And so it's the body's natural way of just maintaining some kind of balance and maintaining some amount of hormones. But the problem too is that because our metabolism slows down so much, a lot of people put on a lot of weight, and then that just becomes really detrimental as far as the joints are concerned. And women are much more likely to gain weight than men are. So that's one reason. Second thing is the hip angle. So when I talk about the hip angle, you know how women have wider hips than men do. And so therefore our femurs, our thighs come down at an angle, whereas guys are just sort of straight down. I think that hip angle actually makes us more prone to wear and tear in the hip joints. Our hormones, I don't know, is there anything that hormones don't complicate? I haven't found it yet. So really a couple of the key hormones here that I just want to touch on are cortisol and estrogen. So y'all know about estrogen. It's a reproductive hormone, and cortisol, you've probably heard that word before. It's a stress hormone. As estrogen falls, as we come into menopause, it actually dials up cortisol. So our stress hormones come up as our estrogen goes down. Cortisol makes us feel pain more. So we are much more likely to feel pain as our cortisol levels come up. And again, because we have these shifting hormones that men don't have to deal with, I think we have cortisol that is much more likely to just go haywire. And life expectancy. There are just more women, period, as we get older, because men die earlier. So I'm not sure if that's a good reason as to why we're more prone to arthritis, but there are just more of us having it because there are more of us. What can we do to help? This is my favorite part of this presentation, because I love to give you tools and tactics, things that we can do. So I'm going to talk about, I think, 6 things. The first is nutrition. And I put this one first because honestly, what you eat and drink really matters. It makes a big, big difference. And, you know, Patty, if I could get you to just type in the chat for everybody to see, tell me how you feel about how food affects your arthritis. I think this is a really cool thing. I mean, Patty and I have talked about this, and she really notices that when she eats certain things or doesn't eat certain things, it makes a massive difference in the way she feels. So you just go ahead and type that in. Like I said, I can't read it right now, but everybody else can. Sugar, processed foods, red meat, alcohol, gluten, dairy, all of those things are potentially things that can increase the pain that you feel from arthritis and the inflammation. They are all things that typically will drive up inflammation. And when we're talking about arthritis and we're talking about things that help, always think in terms of inflammation, because arthritis, as I said, it is inflammation of the joints. So anything that can lower inflammation should, in theory, help you with your arthritis. And I know that some of these things, like the thought of, oh my gosh, cutting out gluten and dairy and alcohol and red meat, I love all those things, sugar, but the more you can do to just clean things up and rein things in, it will make a big difference, not just in how you feel from an arthritis standpoint, but just from an overall health standpoint. I have people tell me all the time when they start eating food more the way it was actually put on this earth, like really eating clean, they have less brain fog. They're able to think better. They have more energy. They sleep more deeply, all of those things. So it truly affects your overall health. Some special things to think about are foods that increase sulfur. So you guys, we'll talk about this in a little bit with certain supplements. You've probably heard of certain supplements that have sulfur in them. It's because sulfur basically just helps give you some things that help to rebuild the joints. So things like cabbage, onions, asparagus, garlic. Those aren't all my favorites, but I would eat them if they were going to help me with arthritis. Asparagus and garlic, I'm thumbs up. Cabbage and onions, but I would eat them. Eat foods high in omega-3 like fish, chia, flax seeds, walnuts, pecans. So omega-3s are awesome, 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 awesome. When I see new patients, one of the things that I tell them in their report of findings, I just give them some ideas of supplements that would be good for them. The 3 that I recommend across the board for everybody, number 1, sorry guys. Number 1 is omega-3s. Those fatty acids, they feed your nerve system. They are so good and they're great for healing. They are natural anti-inflammatories. So if you are not currently taking omega-3s, I would run out to the health food store. That's one I would definitely get. And like I said, you can get it. It's a little harder to get it in the quantities that you need from food, but incorporating any of those foods on a regular basis are really smart. Bone broth. You guys have probably heard this before. There's a huge movement toward bone broth and collagen. Well, because collagen is part of what makes our joints. So anything you can do regularly to supplement collagen and boost the amount of collagen you have in you is really going to help. I would, if you're going to do bone broth, I would go to a health food store and make sure that you're getting grass-fed bone broth. You want it to be high quality. So don't just go and get beef bones or whatever from the grocery store. I would actually get grass-fed beef bones, and you can make your own collagen or you can buy it. And fruits and veggies. Fruits and veggies, there's nothing that fruits and veggies won't help. So yes, they break down to sugar, but the flip side is they are full of great antioxidants and vitamins, which also help to just drive down inflammation. Okay, number 2 is weight. So I touched on this before. Why are women more prone? Well, because we tend to gain weight more in our older years than men do. More weight simply puts more pressure on all the joints. Like that's kind of common sense, but it's really hard to stop once you get on a roll that way. Like I said, women tend to gain weight in and around menopause. So I would make an effort to find out what the normal body mass index is for your height and stature. BMI isn't the be all and end all, and there are some considerations. So depending on your ethnicity, or if you're highly athletic, which I'm not sure any of us are, I'm definitely not, BMI may not be accurate for you, but I think for the vast majority of us, it's a good guide as to where our weight should fall. And the more you weigh, the harder it is to participate in movement. I mean, if you weigh so much that it is really difficult to get up and down stairs, you're not likely to go out and walk 6K every day. It's hard. So that's why keeping your weight in check and really being aware of, I don't want you to live on the scale, but I would just say be aware of how your pants are fitting. If your pants are getting tight, you may need to really rethink what you're eating and seek out the help of a holistic nutritionist to help you with that. Cindy, you would be able to help with that. Movement. Okay, movement is life. I say this all the time in clinic. Movement stimulates brain health. Movement, there is nothing that movement doesn't help. Movement actually lubricates joints. So remember I said you've got this bubble, this synovium around the joint, and part of what's inside of that is joint fluid. Think of it like, I'm really not the one to be using a car analogy, but like oil in a car or oil on a door hinge. You want that nice lubrication, and the more you move, the more it actually stimulates more cells that create that joint fluid. Move it or lose it. You guys probably know that if you sit for long periods, it feels stiff getting up. Well, if you just stop moving for long periods of time, you will probably find that it makes it way harder to begin moving again. And I'm not talking about just stiffness. If you're used to a certain kind of exercise and then you just stop doing it for a couple of years, it's really hard to get back into it. Your body will just fight it. So it's the same with arthritis. I know that movement, especially if you're talking about feet and well, and hips too. I mean, if you've got hips that are wearing away, movement hurts. But where you can, stay moving as much as possible. And notice that I say movement and not exercise. Exercise is awesome, but there comes a point where you're probably not going to be doing a CrossFit workout anymore. I don't know, maybe you would. I'm not there yet, but it's not about the exercise, it's about movement. So just staying mobile. So one of the things that Cindy and I have kind of arranged for you guys to get as a bonus gift is a video that I shot of I call it Monday morning mobility routine. And what it is me going through a series of movements that you can do. I always tell people it's in the time that it takes you to brew your coffee or steep your tea. You can do this every morning. You can do it every night. I had somebody just tell me the other day that they did it at night before bed and she couldn't believe how much better she slept. I've never done it at night, but it makes a lot of sense. So, and it's just simple movements. It's just little movements that get every joint in your body moving. And chiropractic adjustments. So chiropractic adjustments, they are designed to get your spinal joints moving. When people lie down on the table and they have areas of their spine that are actually stuck, especially if it's the arthritic, the worn and torn areas, my job is to get those joints moving and restore normal motion in and around that area. That's one of the things that helps to get people out of the pain that they have, but there's also a bigger picture involved. When we adjust the spine, every adjustment actually has a direct effect on the prefrontal cortex of the brain. Your prefrontal cortex, that's the part that really makes you human. It has dominion over so many things, how you judge things and plan things, inflammation control, your pain response, your hormones, your emotional response, like all these big things. So if we're adjusting in the local area of the spine, it's helping to decrease pain. But because of the direct effect that we have on the prefrontal cortex of the brain, which is where your inflammation and pain control centers sit, we are actually helping your body normalize the pain response and decrease the inflammation throughout the body. So, even if you have arthritis in your hands only, getting it adjusted is a great way to help that because it helps to normalize everything in the body. Let's talk about supplements for a little bit. And I know that if you have arthritis, probably a lot of these supplements you've already heard of and you know about. Awesome. So omega-3, I already told you about, but that's sort of like, that's the number one supplement that I would always recommend for anyone who has arthritis. Picture it like beautiful oil that's just bathing all the joints. It's such a great supplement for healing. Glucosamine sulfate. So again, we talked about sulfur before. Glucosamine sulfate, it basically helps to rebuild the joints. It's got lots of good enzymes and things that help to make proteins that help you to rebuild the chondroitin in the joint, the collagen. So I always tell people, give it a try. You have to give it about 2 months. And if you don't notice a difference, you don't need to take it. I guess that's one thing I would say about supplements in general is there is no one size fits all. And you've probably found this out. I think that's one of the big frustrations that people have with arthritis is There is no set formula. I can't tell you if you do these things, you'll have less pain. So much of it is trial and error, and what works for you might not work for the next person, might not work for me, and what works for me might not work for you. But the point of a workshop like this is just to give you as many different ideas as possible that you can take home and try so that you can figure out if there is something that works for you. MSM, or methyl sulfonylmethane, I always have a hard time saying that. MSM it's kind of like glucosamine sulfate. It basically is a natural anti-inflammatory, and it helps to rebuild joints. Proteolytic enzymes, those are basically things that you take on an empty stomach that help you digest food. Why does that matter? Because there's so many good things in your food that will actually help your arthritis. And the better you can break them down, the more effectiveness you're going to have. I actually read a really interesting study today that talked about proteolytic enzymes. And this particular study, they had a control group and an experimental group. The control group got nothing, so just placebo effect. One of the experimental groups got NSAIDs, and the other experimental group got proteolytic enzymes. And they found that the group that had proteolytic enzymes, they had more pain control than people taking 2 NSAIDs, and way more pain control than people who had no intervention whatsoever. So these are kind of cool. You can get those at a health food store. So you just, when you go in, just ask them for those. But you want to make sure you're taking those on an empty stomach. You want to take it before food. Curcumin. Lots of you have heard of curcumin or turmeric. So curcumin is sort of the active anti-inflammatory ingredient in turmeric, which is that Indian spice that we love to cook with. One of the things I will caution you with, a lot of people find that turmeric or curcumin can upset your stomach. So again, you just have to play around. For some people, it's okay to take, and some people, it's just not going to work for you. And the last one, I don't know how many of you have heard of this. It's SAMe. It stands for S-adenosyl methionine. So I prescribe this for patients who suffer a lot from anxiety and depression. This is a really key player in that. I didn't realize that it actually has a lot of effectiveness for a lot of people with arthritis. And I guess the added bonus is that if you also happen to suffer from depression and anxiety, it's going to help balance out your neurotransmitters as well. So that's a kind of a new one that I had heard of, but when I researched it, there's a lot of studies coming out with it. So again, I would give it a try. Medications, this is not in my wheelhouse. You guys probably, if you have arthritis, you have some kind of arthritis medication, even if you've only been prescribed NSAIDs. This is something you need to talk to your medical doctor about. Use it with caution. So my approach is always do whatever you can naturally first and try and get as much relief from it as possible. Try and peel as many layers away from the problem as you can naturally. And then whatever's left over, if you still have a lot of pain, then you use the medication. Medications have side effects, and sometimes you can take a medication and then the side effect causes you another problem. So, and I'm sure you know that. So use with caution, but don't get me wrong. I mean, I think we're so blessed to be in an area of the world where we have so many different kinds of medications available to us that if you have a problem and nothing else works, thank goodness we have medication for it. And again, that's something that ideally you would want to work together with your medical doctor and your natural health care provider to provide some kind of collaboration, hopefully some kind of open communication around how is the best way to do this. And then finally, mindfulness. So meditation, mindfulness, however you want to say it, just this idea of slowing down your mind. We totally underappreciate what this is. Releasing stress goes further towards solving any health challenge than almost anything else. And really, we should always be starting there. Mindfulness really has been, there is a ton of science now that supports the idea of using a mindfulness practice to help deal with pain. And then the added bonus is that it also helps you deal with a lot of other things in life. So I put it as number 6, but honestly, I would love to put it near the top as well. Mindfulness is really, it's a very good jumping off point for any kind of health issue that you have. So Betty's story, Betty was my husband's grandmother. So she was Gigi to us, great grandma. And She was such a wonderful woman. I loved her to death. And I had lots of opportunity to interact with her one-on-one before she passed away. We used to meet once a month for lunch. We'd go to Swiss Chalet and just the two of us would have lunch together. And, she was also a patient of ours at our office in Aurora. My husband used to adjust her, and she was in her 90s when she died. So she had arthritis. She had all sorts of different kinds of health issues, but she was the most positive, amazing, energetic, youthful, vital woman I have ever met in my 90s. She was incredible. And one day she was dusting up at the top of a hutch that she had in her dining room, and she fell off the chair, but she managed to pull the hutch over onto herself, which could have been really devastating. But she was really hurt, went to her medical doctor. They were taking care of her from that perspective. But weeks and weeks and months later, she was still having all sorts of pain. And she went to her medical doctor and she told him, and what he told her is something that probably a lot of you have heard. He looked at her and he said, Betty, he didn't say it like this. He didn't say you're old, but he said you're, however old she was at the time, she was in her late 80s or maybe her early 90s. He said, what do you expect? This is as good as it's going to get. You're just going to have to accept it. And so it just so happened that she went from there to Craig's office to get adjusted. And she sat down in his consultation room and she just broke down into tears. She was so sad because he had just basically said, this is what you have. You're getting old. You just need to deal with this. And I hear that story all the time in my office where people have been told that. And to be honest, they come to me. I'm kind of the last resort person, which I'm totally fine with. But one of the things that I always want to tell people, and this is what Craig told his grandma, it's never over. It's never just this. We can always be better. And so he adjusted her and he gave her some specific exercises to do that were going to help the area that was a real problem. She, in her nature, she did everything by the book. She did everything so diligently and she got better. And within probably 4 to 6 weeks, she was almost back to her normal self again and so happy. And one of the things that she said was, the best thing that you gave me that day was hope. And if I can give you anything today, it is that understanding that if you still draw breath, you can always be better. The human body is really an amazing thing. You are an amazing, amazing living being. There is always more inside of you. And anything that we as natural healthcare practitioners can do to help you tap into more of that, we will do whatever we can do. But more importantly, I just want to encourage you, never think that this is as good as it's going to get. There is always more and there's always better. So I'm going to stop my sharing now and come back into the room. That's all I have to share with you about arthritis. So I guess we can just open it up to questions now or comments.
All right. So first of all, this is why I wanted you to talk. This is exactly what I have been working towards with what I do. And I was like, it's like-minded people. I just need people to continue the conversation, continue and to inspire us and give us hope. And that is exactly why I had you join us. So I thank you for that. I would like anybody that has a question, throw it in a chat box for me. I've got a couple that I'm going to start with that I saw kind of come up, and then I have one myself. Kate asks, how much omega-3 in a tablet form would you recommend daily? Do you have a recommendation for that, or is that read the label and try to follow the recommended label?
I always recommend in the range of 750 to 1,000 milligrams. Some of it depends on how you like to take it. Do you like to take it by liquid or capsule? What brand do you like? A lot of people don't like the fishy flavor at all. So there are some brands that they sort of specialize in not having that repeater. So I would say just look at the label and ask ask the person in the health food store for something that is as high as you can get in the omega-3s.
All right,
Yeah.
perfect, perfect. I have a question because it's something that I get asked a lot. When do you know whether to put heat or cold on a sore joint area?
Oh, that's a great question. Yeah, I find when it comes to arthritic joints, heat, and especially a damp heat tends to work best. I typically think of ice, if you sprain your ankle or you run into a door frame and you've got a big goose egg on your head, ice is awesome for that. But most people find that a nice moist heat is just much better on arthritic joints. So that's what I would go with.
Awesome. All right, Tiffany, does a crinkly sounding neck, is it a sign of something to be concerned about? And what symptoms should I be aware of if I think I might have arthritis in my neck?
That is a great question. I would say the older you get, the more crunching and creaking you hear in all of your joints. So that those sounds, the sort of cracking sounds as you move around, that doesn't bother me so much, especially if there's not pain associated. Now, if you hear a snap and you feel a lot of pain, some people will have that. That's something you want to get checked out. But if you're just hearing a lot of sort of crunching and crackling, that is just, as we get older, that's just part of it. How do you know if you have arthritis in your neck? Really, that's something I would go see a chiropractor, go and get it. You can tell by symptoms, but just because somebody has pain doesn't mean they have arthritis. Really, that's something I diagnose through an X-ray.
All right, awesome. Okay, sometimes it is hard to do simple things like open a jar. Is there anything that you can do that would help?
Cindy, just so you know,
Oh, okay. We froze.
see Patty moving, so there you go.
Okay,
Sorry about
sorry
that.
about that. Oh, whew, we got a little delay there.
Yeah.
All right. So, question. Sometimes it's hard to do simple things like open a jar. Is there
Yeah.
anything that we can use or do to help?
I think, any gadgets that you can find that will help you with those things, you get to a point where, especially if you've got swelling and even, misshapenness in your joints, you may get to a point where there are some things you just can't do anymore, and especially strength too, right? Yeah, like opening a jar, that's a really good example. That's probably one of the most common things people with arthritis struggle with. That's where you have to come up with go arounds. So I always say, if it's stiffness, try and move through it. But if it's painful, I think you should avoid it personally. And then if you lack the function, the ability to do something, try and see if there's something on the market that allows for you to be able to do that. So I have this great, I don't even know what you call it, but I bought it at a pampered chef party like 20 years ago. It screws up into the bottom of my kitchen cupboards. And so if I want to open a jar, I just jam the jar into it's a V-shaped thing. I jam the jar into the corner of it, and I can reef on the jar with my whole hands to open it. So that's one thing that makes that kind of thing easier for me. So there may be things that are out there. If it gets to the point where you're talking about a major function that is not allowing you to live independently, that's where you may need an occupational therapist or somebody who may have something that you're not just going to get it over the counter at some pampered chef party. Do you know what I mean? Yeah.
All right. I have a question. Can you describe the movements that you recommend for arthritis? Now, I know we can't get into a whole big. That's a whole other workshop that we could do, but maybe just some general things. And again, I'm going to forward the video on for everybody to get.
Yeah, I would say take a look at the video. When you watch the video, it covers, I think, just about every joint in your body, and you can do it along with me. So if you do that every day, but it just, when I say movement, I'm just talking movements like this, like just any kind of movement. So when you're sitting watching TV, for example, move your fingers,
Shoulders and
shoulders,
yeah,
move your neck in all of its normal
twisting.
range of motion. Yeah, just any kind of movement is going to help to decrease the stiffness and lubricate those joints. But take a look at that video, and excuse me, I have a YouTube channel too. Well, you can just search my name on YouTube and you'll find I've got tons and tons of different kinds of videos. So if that gives you some ideas of movements as well.
Nice. Just a little note, Beata has told us Lee Valley sells a blue flexible plastic pyramid shaped thingamajig that works wonders for opening jars. So
That is
anybody
awesome.
wanted to
They
get
have
that.
everything. That's cool.
That's awesome. All right. Well, I want to thank you again, Dr. Shauna, for this great presentation. Just wonderful information, inspiring. As you were talking, and I was seeing those X-rays, I was like moving my spine. I was like
Yeah.
stretching things out. I was like, oh, I got to get myself moving. So it just it reminds me of what I have to do in terms of the mindfulness for my own body, which is super important. I have recorded this chat today, so I will create a blog post and post the chat on there, so that you can go back to it if you want to get information that you maybe missed, or wanted to look at again. Um, Contact myself, contact Dr. Shauna if you have any questions, any thoughts. If you want to book an appointment, she's in Port Perry, which I wish I could go to Port Perry because I need to come and see you. But I thank you again for all of that information. And you're right. There, keep the hope, keep the fire burning, and just keep moving, because it's all it's about is just keep moving.
One
Um,
thing I will
mhm,
say right
yeah.
now, Cindy, is that whenever there's a lockdown or a stay-at-home order, you are allowed to go to your healthcare appointments. So whoever your, your chiropractor, your dentist, your eye doctor, all those things, they're all open. I mean,
Mhm.
even the government acknowledges that your own self-care is really, really good for your health right now. So if you feel like you can go, don't think that because there's a lockdown that they're closed, because they're not.
Excellent.
Yeah.
And I will send out the bonus video to you all, which is Dr. Shauna's video. I will send that out to you as soon as we're done today. So please share that with your family and friends. And any of the money we collected tonight is going to the Arthritis Research Canada. I contacted them, but they got back to me really late in the game. But they were so excited that we were doing this presentation and in this, and they'll, even if it's a little bit of funds, they'll take anything. And what I love, why I wanted the research money to go to them, is like 82% of the money they collect goes right into programs. So I love that they put that right back into the programs that they offer. And I think that that's it. I wish you a very wonderful time. I thank you for joining me. And I wish you all the best, everybody. Be well, be healthy, and we'll see you guys soon. Take care,
Thanks,
everyone.
everybody.